From Module 1, I looked at ethnocentricity and cultural relativism and how they are defined and what the differences amongst the two terms are and how they are viewed in a real-world situation. I found that ethnocentricity is the belief that one's own culture is superior to another culture, and that cultural relativism is the belief that all cultures are of equal value. So basically, these two terms are complete opposites of each other in what they believe and how they are defined. This made me ask the question, how does a healthcare professional or provider treat a person who has a ethnocentricity cultural belief? Do you treat them like any other patient, or do you take into consideration their beliefs and methods? I speculated that many people around the world come from many different cultures and backgrounds that have several different beliefs. I asked this question because it can cause patients of different cultural backgrounds to feel unimportant, frustrated, disrespected, or confused. And in order to prevent this from happening, healthcare professionals and providers need to take in consideration cultural beliefs and treat patients accordingly and in a way that respects their cultural beliefs. I found that in order to make things easier and to provide better communication amongst healthcare professionals and their patients, healthcare professionals need to consider the values of different cultures, which is defined as cultural relativism. Cultural relativism puts into place the idea that all cultures are equal in value and need to be studied from a point of view that is neutral. Cultural relativism takes on objective views of different cultures and incorporates the idea that a society's moral code defines whether something is right or wrong for members of that society. When healthcare professionals take this approach when dealing with their patients, it makes the patients feel like they aren't being treated less or more than anybody else, and it makes them feel more comfortable and relaxed on the kind of treatment that they are receiving. In conclusion, from the definition I just gave on cultural relativism, healthcare professionals and providers need to come from a neutral standpoint of cultural relativism when dealing with patients who have an ethnocentricity cultural belief, because it will make things easier not only for the patients but also for the healthcare professionals and providers themselves.